The medulla oblongata is going to connect pons superiorly with the spinal cord inferiorly. At the origin of the anterior and posterior roots of the first cervical spinal nerve, the junction between the medulla and the spinal cord is present, which is going to correspond to the level of the foramen magnum. This is the medulla oblongata, which is conical in shape. The broad extremity is superiorly directed, and the central canal of the spinal cord is going to continue upwards into the lower half of the medulla. In the upper half of the medulla, it is going to expand as the cavity of the fourth ventricle. On the anterior surface of the medulla, the anterior median fissure is present, which is continuous inferiorly with the anterior median fissure of the spinal cord. Swellings on each side of the median fissure are called pyramids. So you have to remember PCP, because pyramids are made up of something that starts with a C, which are the corticospinal fibers, and they are going to originate in the large nerve cells in precentral gyrus of the cerebral cortex. So PCP, pyramids, corticospinal fibers, and precentral gyrus. So here we can see the pyramids. The pyramids are going to taper inferiorly, which is a very sad thing. And the majority of the descending fibers are going to cross over to the opposite side, and they are going to form the decussation of the pyramids. So here we can see an ant, and the name of this ant is ant EAF, which is external arcuate fibers, which are anterior. Where does ant EAF come from? She has come from the anterior median fissure, which is her home, which arises above the decussation. Now she is going to travel laterally, and when she goes laterally, she is going to reach the medulla oblongata, and then she is going to reach the cerebellum. When she reaches the cerebellum, she suddenly feels very hungry. So where would she get her food? Then someone tells her that posterolateral to the pyramids, there are olives from the inferior olivary nuclei. So the groove which is present between the pyramids and the olives has the hypoglossal nerve. Posterior to the olives, the inferior cerebellar peduncles are present, which are going to connect the medulla and the cerebellum. Between the olives and the inferior cerebellar peduncles, or ICP, we are going to have three nerves, which are glossopharyngeal nerve, the vagus nerve, and the accessory nerve. Okay, now posterior part of the superior half of the medulla oblongata has the floor of the fourth, and EAF wanted to go to the disco because she wanted to enjoy life a little. She wants to hit the floor of the fourth ventricle. So where is she going to find the disco? The disco is present on the PS, which is the posterior part of the superior half of the medulla oblongata. But after going to the disco, she got the symptoms of PMS, which was present on the PI, which was the posterior surface of the inferior half of the medulla oblongata. The posterior surface of inferior half of the medulla oblongata is going to be continuous to the posterior aspect of the spinal cord, and it is going to have posterior median sulcus. And on each side of the median sulcus, gracile tubercle is present, which is an elongated swelling, which was formed by the gracile nucleus. And lateral to the gracile, cuneate tubercle is also produced by the underlying cuneate nucleus.